Hello everybody, welcome to number 1 Doctor channel. Today video is about colonic polyps, which is part of our playlist called Short Medical Notes, in which we will have short videos about important topic in medicine. But please do not forget to like, share our videos, subscribe to our YouTube channel number 1 Doctor, and join our social media accounts in the links below each video. Our aim is to share the correct medical knowledge for all for free share and be shared. Today we will talk about colonic polyps. A polyp is defined as a lesion which projects into the lumen of the bowel. The relevance in the colon is mainly because of the tendency of some types of polyps to become malignant. The general term, polyp, however, is purely a morphological term and in no way defines the actual diagnosis, for which histology would usually be required, most often obtained by biopsy or polypectomy at sigmoidoscopy or colonoscopy. It is helpful to consider polyps under the different pathological headings. Adenomatous polyps. Adenomatous polyps are important because of their tendency to lead to colorectal cancer. Most authorities believe that the majority of adenocarcinomas of the colon develop from pre-existing adenomatous polyps. Evidence for this belief includes the fact that early stages of malignancy, severe dysplasia and carcinoma in situ, may sometimes be found in polyps, and that patients with familial adenomatous polyposis die of cancer at a young age unless they have a prophylactic colectomy. In addition, carcinogens which produce adenomas experimentally also lead to cancer formation, and studies in which patients were followed up after previous colorectal cancer, where polyps were prophylactically removed at colonoscopy, appeared to have a reduced incidence of subsequent new cancer development. The likelihood of an adenomatous polyp becoming malignant seems to relate to its size. It appears to be rare for adenomas under 1 cm in size, but occurs with increasing likelihood as the polyp gets bigger. Adenomatous polyps of the colon are usually subclassified into the better differentiated tubular adenomas, 75%, which are often on a stalk, and the less differentiated villus adenomas, 10%, which are often sessile, i.e. flat. Sometimes a polyp is described as tubulovillous, 15%, when it has an appearance somewhere between these two extremes. Adenomas can be sporadic or familial. The familial adenomas occur in conditions such as familial multiple polyposis coli and Gardner's syndrome, and they have a high if not inevitable chance of developing into cancer. Familial multiple polyposis coli is an autosomal dominant condition with multiple neoplastic colonic polyps beginning in the 2nd to 3rd decade, and patients usually have a prophylactic colectomy in their early 20s. Gardner's syndrome is an autosomal dominant condition with multiple colonic adenomas in association with bony osteomas and epidermoid cysts. Other than being premalignant, adenomatous polyps may present as follows: bleeding, which may be either frank blood or microscopic bleeding, present with anemia. Polyps rarely present with a change in bowel habit, but a large benign polyp in the rectum can produce the symptoms of tenesmus, i.e. a sensation of incomplete evacuation due to the presence of a mass within the rectum. Polyps may also secrete a large amount of mucus, and the patient may complain of passing slime or jelly. Rarely, a polyp will prolapse through the ano or act as the apex for an intussusception. Polyps may be diagnosed on imaging the colon with a barium, but if suspected, the best investigation is usually a colonoscopy, which gives the additional advantage of providing the opportunity for biopsy or complete removal of the polyp. Key points on histology, other than the diagnosis of an adenomatous polyp, will be whether or not there is any evidence of dysplasia of the cells on the surface of the polyp. Most histologists would classify this as mild, moderate or severe, with severe dysplasia being strongly suggestive that the lesion is premalignant. Hematomatous polyps. A hematoma, a lesion where there is an overgrowth of one or more of the cell types which are normal constituents of the organ from which they arise, is an unusual lesion defined as an abnormality of development. With regard to colonic polyps, there are 2 conditions in which hematomatous polyps are normally described: juvenile polyps. These have a low malignant potential. They may present with bleeding or intussusception and sometimes slough off spontaneously and actually present with material passed in the motion and noticed by the patient or parents. Usually it is possible to deal with them colonoscopically. Poitz-Jeghers syndrome. This is a rare autosomal dominant condition where multiple hematomatous polyps appear throughout the entire GI tract. The affected individuals also have pigmentation of the skin around the lips and gums. Again, the malignant potential of these polyps is small, although overall the patient is at a greater risk of developing carcinoma, both GI and non-GI tract polyps due to protrusions of mesenchymal tissue conditions such as lipomas, benign tumors of fat, leiomyomas, benign tumors of smooth muscle, neurofibromas, benign tumors arising from nerve tissue, and hemangiomas, benign tumors of blood vessel origin, can all occur in the wall of the colon. If they then form a lump which protrudes into the lesion, they are by definition polyps. These are all rather rare in clinical practice, and their main importance is that they may mimic the presentation of a carcinoma. Metaplastic polyps. These are sometimes also called hyperplastic polyps. They are usually small, often multiple and slightly raised above the surrounding normal mucosa. They have a distinctive histological appearance and have no malignant potential whatsoever. Because of their small size, they cause no symptoms, and their only relevance is in distinguishing them from adenomatous polyps. They are often seen in inflammatory bowel disease or lymphoid hyperplasia, such as at the appendix. If they are found incidentally at appendicectomy, then usually no other treatment is required. Inflammatory polyps examples are those found in inflammatory conditions of the bowel, such as pseudopolyps in ulcerative colitis.